So working with induction of labour. So if it is that you've got to the point where you know you're having an induction and you're getting really worried because you think this is a medical intervention and all your hypnobirthing has gone to waste, then let me reassure you this is not the case, because you can work with your induction. So what I mean by that is induction usually starts, so if it is that you know you're heading into an induction, let's say in a couple of days time, then you can start now with your breathing techniques and your hypnobirthing practices before you get to that point, because it might be that you can still stimulate your own labour to start before that point. And often when we get into induction, we still need to be in a relaxed state to help our own body progress, but also induction often starts with a pessary, which is placed up into the vagina, and this is used to try and soften the cervix. So during that time, they normally allow you to have at least 12 hours for that to work. So sometimes they'll send you home, sometimes you'll remain in hospital. But within that time, you are free to move around. So I would suggest you go for walks, you try and get outside, you get some fresh air, you practice your breathing techniques, whatever it is, it's going to help you relax, even if it's your partner giving you a massage. Whatever it is to get your body to relax will work with and will help that first induction. So at that point, if your body still isn't starting labour, then eventually they will progress onto the catheter and inject Pitocin into your body. But again, this is not the end of your self-care and hypnobirthing techniques, because they can still be used alongside the Pitocin, because Pitocin is the same as oxytocin, it's just the fake version. So that still stimulates those contractions within your uterus, which still requires oxygen, which means that you still need to be doing your breathing techniques, which still requires you to be relaxed so your body can release your own endorphins to help with the pain management. So although people think induction of labour is the beginning of the end, it is not. It is where you can still use all the techniques you've learned to help with the induction of labour.